Assalamualaikum warahmatullahi wabarakatuh. My name is Zuriah Binti Ikah, metric number 1172020. Today we will present about directory for COVID-19 recommended treatment by World Health Organization. The outbreak of the novel coronavirus disease COVID-19 in China spread worldwide in December 2019, becoming an international emergency of major concern. The aim of this study is therefore to provide an easy medium for the public to learn about the treatment associated with COVID-19. All the information suggested by the WHO about the treatment of COVID-19 was gathered from this report, including self-care treatment, medical treatment, vaccine effectiveness, and even the effect of antibiotic against patients.
This information is made available to everyone, especially children and an elderly at-risk group in the case of COVID-19. It helps people to gain knowledge and know the treatment recommended by WHO about COVID-19. It provides guidance on caring patients infected with COVID-19. Besides that, people can learn about the symptoms of COVID-19 and also home care for patients with suspected or confirmed COVID-19.
Hi, Assalamualaikum. My name is Alia Binti Azhar and my metric number is 1172022. Okay, I will explain to you about the justification of our directory. Our goal in selecting this topic is to make it easier for people such as government team, medical team, or any front lines of a country who want to get information about recommended treatment by WHO for COVID-19 quickly and accurately. This directory will guide the people that want to seek information about the treatment for treating COVID-19. We also include different types of sources for every subtopic to ease the searching for information about this topic. Some terms of the sources might not be understood by the people that are not in the medical team. This directory also will expose the public to the effectiveness of vaccines and antibiotics effect against patients.
Subtopic. There are some references that have been founded, which are one from ebook, one from article, 5 from website, 2 from journal, and 1 from online newspaper. All the references are explaining about COVID-19, its history, early sign of infected patient, how COVID-19 is spread, and also WHO recommended treatment. However, it only gathering a few references without giving detailed information on it. To conclude, this subtopic is only giving the general point of COVID-19 before going more focused on the treatment recommended by WHO in the next subtopic. Okay, next, self-care treatment. Self-care treatment. For self-care treatment, there are 3 article sources, 5 website sources, and 2 journal sources. First, self-care during COVID-19, such as physical distance, good respiratory hygiene, and hand washing are important examples of self-treatment actions you can take daily to protect yourself from COVID-19. And there are many other ways in which self-treatment can make a difference to your health and well-being during the coronavirus pandemic. And if you feel sick, you must rest, drink plenty of fluids, and eat nutritious food, stay in separate room from other family members, and use the dedicated bathroom if possible. Clean and discard frequently touches surfaces. Then, this self-management strategy is divided into problem-focused and emotional-focused strategies, aimed at changing the environment to reduce pain, and the latter addressing the psychology of living with endometriosis. And the WHO and CDC provide the most guidelines and recommendations on self-care for those who do not need hospital treatment. According to WHO guidelines, patients and household members should be educated on personal hygiene and how to care for family members suspected of having COVID-19 disease as peacefully as possible to prevent the infection from spreading to household relationships.
Okay, for my part, for 2.2. The topic is medical treatment. The subtopic is medical devices usage. So the sources that I get is from website, document from website, journal and book. So for the website, I get 5 sources. For the document from website, I get 1 sources. Journal, I get 2 sources, and book 2 sources. So the website is all about the list of standards that need to be followed by the manufacturers that want to make a PPE. For the medical team, they must follow the list of standards from WHO. And then from the book, there's a list about the history of the PPE, where the PPE have been used by the medical team for a long time ago, but in this COVID-19, the PPE has been in the shortest stock. So the manufacturer or manufacturing like factory have to produce more PPE in further in this current situation. Okay, that's all from me. Thank you.
Okay, next, let us take a look about the effectiveness of vaccine. For this subtopic, there are 4 journal sources, 2 article sources, and 4 website sources. These are encompassing the vaccine potency and value toward COVID-19 patients and other people who want to prevent them from virus. Plus, it is also described on vaccine expansion and distribution, which focus on its function to protect our body, ingredients in vaccine, and 3 phases of clinical trials, including type of vaccine. Moreover, this subtopic also describes about vaccine safety testing methods in order to increase credibility. Besides, it is explained about the preference of the Pfizer-BioNTech COVID-19 vaccine to specific population, as well as the COVID-19 vaccination intention. To analyze the research in more detail, COVID-19 mRNA vaccines and their application in chronic liver disease also involved in this topic. In conclusion, this topic clarifies the practical guidelines that offer broad recommendations for COVID-19 vaccination in various subgroups of allergic and immune disease, highlight risk or benefit assessment, and where and how routine vaccination should be changed.
Antibiotic containing or using a substance that can destroy or prevent the growth of bacteria. And antibiotics are medicine used to prevent and treat bacterial infections. The more the bacteria are exposed to antibiotic through treatments that are unnecessary, they will develop resistance. And with COVID, there's a very large expansion in the number of patients with respiratory disease, where patients might feel the urge to take an antibiotic. While in reality, COVID is not a bacteria, it is a virus, and the use of this antibiotic will not treat them, but it will create resistance among bacteria that already exist in our body. Antibiotics do not work against virus as they only work on bacterial infections. COVID-19 is caused by a virus, so antibiotics do not work. Antibiotics are used in human and animal medicine and are classified as being critically important as well as important antimicrobial monitoring to COVID-19 patients. An antimicrobial is an agent that kills microorganisms or stops their growth. An antimicrobial is a medicine can be grouped according to the microorganism they act primarily against. For example, antibiotics are used against bacteria. From the timetable, you can see that it's a difference between virus and bacteria. From the virus, It cannot be treated with antibiotic, while bacteria can treated with antibiotic. And the picture is an example of antimicrobial or antibiotic. Therefore, the use of antibiotic in COVID-19 patients is not able to eradicate the virus and cure the disease because antibiotics are only specific to bacterial infection, not virus.
For the conclusion, people should stay aware of the latest information on the COVID-19 outbreak provided by WHO and follow the direction of the local health authority and prevent secondary infections, interrupt human-to-human transmission to people close contacts, healthcare workers, and prevent further international spread. There is no need to be panicked, and proper prevention and management are essential to combat this disease. That's all from us. Thank you.